All right. So Sue, how many months has it been since you got your allografts in your knees? You did both knees.
Since August 2nd,
August.
2019.
Nice. Okay. So we're.
Oh, and today
So
is
it's
the 20th
yeah.
of November.
So it's about 3 months, right?
3 months.
So regeneration happens between 3 and 9 months. So we're really now these cells are really starting to do their job and regenerate in those knee areas. And you know, you were shocked when you look at your knees, right? Because you're very active.
Oh, very active. I am 64 years old, and I am walking stairs every day, and I work out and eat good. I'm healthy, but let me tell you, my body takes a load. I'm working really hard.
Because you work with a lot of people. You work with
a
people.
lot of
You take care
I'm
of
a
people.
therapist, and you know, I have to move people, kids, lifting, use body mechanics all the time, but always in motion.
So Sue, what was going on with your knees before we did the stem cell allografts?
Before, I was feeling a lot of clicking in it, and I was feeling almost like a little bit of movement, and definitely you could feel it just once in a while. It would get locked, and I would go, oh gosh, it's that knee. And I'm always down on the floors, up, you know, and it used to be a little harder to get up, and I'm serious. I really have been feeling so much better. I don't feel the click. Has it regenerated? You know, I'm not sure if it's completely, started this process on me, but I'm going to say there has been a difference since August. And that's all I can go, is that I'm not having the clicking. I am not feeling as much of that. You know, I have no lockup. I have not had one lockup since August. So.
And you could go up and down, and the lockup.
Yeah, and I do.
And the lockup happens, Sue, when there's bone on bone, and that's a true bone on bone case. Is when it locks. You know, a lot of people are told they have bone on bone, but they don't because they're just looking to do a knee surgery for that person. But yours was truly bone on bone.
I had seen it in your X-ray,
especially because then that's why we take X-rays. So we did an ultrasound guided injection. We got it right where it needed to go, which was difficult. And right now at 3 months, you're just starting to get the regeneration, but you're getting all the other healing properties. So I'm glad things are going great now. And for everybody that's watching, if you don't mind, please let everybody know the investment you paid to get this done.
What? I started out, just thinking about, I have to still invest in my body, and it's going to cost me as I age. And when I heard the price, I did my research. I looked this up. I checked with other companies. I called around the country. As I worked with this, I was all in. I did this for $8,000, and I invested in my life. Yeah. And I've invested in my knees. And the other thing I did, Dr. Zano, is I checked out some gel injections to compare. And I'm just going to tell you, I did stop at a clinic and check that out too. And I did find out that that's also temporary. This sticks for my life. This is regeneration, and I'm very excited.
And we're really excited for you. And so if you don't mind, we'll check in with you again at probably 6 months or 9 months when everything's fully regenerated and you're dancing. But I just want everybody to know out there, so everybody who's watching who's either, maybe they're on the fence, or maybe they're skeptical, or they got to pray about it, or they got to do their research. These are all,
find comfort.
These are, you know what, you're right, it's all about finding certainty. Because most of the times I could give you all the research in the world, but if you're not comfortable and certain. So what would you ask that person that literally their life could be changed by this, but they're letting skepticism or even disbelief get in the way of living the life they want to have? So what would you tell that person who's thinking about it?
I'm just telling you, and I would tell anybody, right now, whatever age you are and you're feeling your symptoms, you need to work your body. Our bodies are something that should be number one, and it tilts your emotions, it tilts your whole balance in life. You must work your body. I would tell anyone to invest in it. The investment is your best way to go.
Well, that's wonderful. We're so happy for you, Sue. Thank you so much for helping people.
All right, thanks.